You came back from China 10 days ago, and I want to talk about your experience in China in a minute. But first of all, your boss, the head of the WHO, put out a mortality rate number yesterday that had us all gasping, frankly. 3.4% mortality rate for those infected, which is quite a lot higher than the 1% that we were kind of dealing with roughly beforehand. Explain that number to us and why he's now made that public.
Well, when you look at the numbers in China, there's different numbers, right? And I think one of the things that worried the Director General was that people were cherry picking the lowest possible numbers, and they were underestimating what this disease could actually do. And the number that you heard yesterday, that's if you take from the beginning of the outbreak, including Wuhan and the areas worst hit, right through to today and all of China, the number is over 3. And what people often do is they just look at those provinces outside of Hubei and where Wuhan is, and they calculate from once people really knew what they were doing, and they say, okay, at that point, it was down around 1% or under 1%. But you know what the Director General was highlighting was, if you don't get on this fast, if you don't know what you're doing, if you're not taking care of your older population properly, this is going to have worse mortality than you're expecting. And we have to be careful, Matt, not to extrapolate directly from China. China has a different demographic than the UK. And also, they're really, really good at keeping people with this disease alive long enough to survive it.
Okay, but should we now be treating the 3.5% mortality rate as our benchmark? Is that the new number that we should be looking at for all of us?
No, what you should be looking at is, you know, this is a serious disease. 1%, 2%, 3%, this is a serious, dangerous disease. What you should be looking at, and sorry, Matt, I'm sounding a little dictatorial here, but what we should be paying attention to is how many people are going to get severely ill, and are we going to have to put in specialized centers and possibly ventilate to help them get through this, and possibly do that for a few weeks? How many people are going to have mild disease that we're going to have to put in repurposed facilities, et cetera, to be able to make sure they're not infecting other people? We should be looking at those numbers, because that's how you're going to manage and control this and bring your mortality down. We know it's a bad, dangerous disease. How do you bring your mortality down? You concentrate your resources, you shorten the time frame to make sure you can identify them very quickly. You look at the high-risk ones and get them into the specialized centers in case they crash. These are the things that we should focus on. Mortality rate, it's going to be different in different contexts. It doesn't have to be that high. That's the key message.
Okay, so when you went to China, what did you discover there that should become a lesson to all of us all over the world?
The first thing that we discovered, Matt, and I think the most important message, and I have to admit, I went there with quite a bias because this is a respiratory pathogen, and we're not used to seeing these kind of viruses controlled through these traditional, let's say, approaches. And that was the first, big learning from China. But in terms of applying that outside of China, I think the critical things that China did well were, first of all, the population knew what it was looking for. They knew what this disease was. They knew where to go to get tested, and they could be isolated and taken care of very, very quickly. People were part of the solution. They were the surveillance system. You weren't waiting for it to walk into hospitals and infect the hospitals. They had a very well-informed population. Then they had planned the capacity to be able to isolate these cases, and they planned the capacity to be able to find the close contacts, quarantine them, and then take care of them for the 14 days, during which 5 to 10% of them would become cases. And the big takeaways are those. And what worries me always, Matt, is everyone starts with, we can't do what China did. And I said, well, why not? And they said, well, we can't lock down a whole city. And I said, well, China didn't either. I mean, they have thousands and thousands of cities. They locked down a few, where it had really gotten out of control. And they never ever did that again. They only did it in one province, not in the other 30, because they figured out how to respond.
But still, it's a much bigger country as well. I mean, they locked down effectively 60 million people, which is virtually the whole population of the UK. Can you seriously imagine this government doing something similar in a country like ours?
I would be seriously surprised and frankly disappointed if the country ever got into a situation where they'd even have to contemplate that. And the great thing you're seeing, Matt, is that Remember, it's not a function of the virus, whether or not you get in a situation like China's. It's a function of how you respond. And what you're seeing as a result of the work of Public Health England, the NHS, et cetera, is they're finding these cases fast. They're jumping on the transmission chains. They're getting them under control. You should never get in that situation. You should never have to even contemplate it. And there's a lot of things you can do before you get there.
Right, so to be clear, China had to take these draconian measures because it didn't keep its eye on the ball at the beginning of this infection.
Well, no one would have had their eye on the ball. This was a new virus nobody had seen before. They had to isolate the virus, find out what they were dealing with, find out how it was transmitted, find out, and then test different approaches. They did all the testing, and now the rest of the world, the rest of China, knows how to approach this thing. So, and look, Matt, in fairness, and I'm not saying this to be popular in China. Every other country in the world has known about this for 6 weeks, and we're still seeing it get out of control in these places. That never happened in other parts of China afterwards.
Okay, so what is the rest of the world not doing that they should be doing right now? Countries like Italy, or perhaps us in a couple of weeks, or Iran, South Korea.
Well, lots of countries are doing the right thing, but what we have to look at, Matt, is there any barrier to finding cases very, very quickly, getting them tested and getting them isolated? And those barriers can be things as simple as, are materials available in the right language? Does the population really know that they're looking for a fever and a cough, not a cold, not a runny nose? This is a different thing. Do they know what they're looking for? Then do they know how to get tested? What I've heard in some places people say is, call your GP. Well, try and get through to your GP during the day, right? And maybe they're off golf.
Yeah.
On Friday, right? And then they're out for the weekend. You've left this infected person potentially in the community for 3 or 4 more days. You have to look at every single thing that might slow down the chance of you finding that person, isolating them, to help them survive the disease and to help others not get infected. That's what we've got to study.
There's a big debate about closing down schools. What's the point of closing down schools if kids, according to the evidence, are very unlikely to get this?
Well, kids are a pretty special part of our population. Matt, I have one of them. And,
I've got 4.
There you go. So we do, we exercise an abundance of caution with our children, and that's a good thing. But what you would, and in terms of what you just said, we actually don't know what happens with children in this disease. It appears that they're less likely to get infected. It appears that they're less likely to get sick. But a lot of that may be an artifact of the fact that this happened in China at the start of the Spring Festival. Because remember, the Spring Festival in China, all the schools are closed for 2 weeks, and then they extended them. So we don't really know what would have happened if children were exposed to big doses of this thing in school environment. Would they have gotten sicker? We don't know. Probably not, in my mind. But would they have carried the virus back to their families and caused more outbreaks that way? Quite possibly. We simply don't know. So one of the things we're looking at in places like Italy and others that get infected are, have we seen any school clusters that might either result in more sickness in kids or help spread it? So far, the evidence isn't there. And it's one more piece of the puzzle that we haven't got the tools to study properly yet. We soon will, but not quite yet.
Okay, just to bring it back to Britain, we've just had the numbers out. Over 80 cases now in this country. It was 50 yesterday. What can you infer from that?
Your cases are increasing, quite obviously, and it's hard to infer from the number. What we need to know, are they geographically clustered and clustered in time and clustered around certain events? Or are these just popping up all over the country and it's evidence of widespread transmission that had been missed, mild cases that have been missed? So the number itself doesn't tell you anything or everything. What it may be telling you is the population is way more aware. They're getting them much more fast, and that could be a very good sign. So it depends a little bit what's behind it, Matt.
Okay, and finally, you came back from China 10 days ago, I gather. Why aren't you self-isolating?
Because you isolate the people who are the cases, right? So I'm clearly not a case. And then the people that you...
How do we know that? Because you've been tested, or...?
Yes, actually, I have been tested, but that was for a different reason. But the first is I'm not a case. Well, I'm not ill, let's say. The second thing is I'm not a close contact of anyone, so I'm not quarantined. So isolation is what you do for the case so the virus doesn't spread. Quarantine is what you do for someone who is a contact. So if they get infected, they won't spread in the meantime. But you're not isolating in the sense that they have the virus necessarily. And neither was, and I wasn't even let's say, a low risk contact. Never came in contact with any cases, never came in contact with any known contacts. Everywhere I was, the incidence was falling, and I wash my hands every half hour.
Right.
I wore a mask because I was in China, but social distancing, you take all the right precautions. We have to be careful because we could end up in a situation where you've got 80 cases in the UK and people start saying, why isn't all of the UK isolated? No, you have to, it's got to be a risk-based decision, but we're going to be very careful, obviously.
Right. But other people who've come back from the places that you've been to, like Wuhan, have been told to basically stay self-isolated for 2 weeks.
Yes. So different countries have different recommendations, and WHO, all of our guidance is really evidence-based. We try and identify the evidence and then base guidance. Now, Switzerland, where we're based, uses the WHO guidance, takes it, I'm not going to say off the shelf, but implements that. In other countries, they often decide, well, we want to add X, Y, and Z to it for various reasons. And that's the case in some countries where they isolate. But the reality is, in Wuhan now, remember, I went into Wuhan, 15 million people were in apartment buildings. I was in big empty boulevards by myself and our team. We came in less contact with people in Wuhan than anywhere I've been since.
One very brief and final one. Is there anything you can tell us about the average age of those people who are deceased as a result of this disease?
Yeah, this is a tragic thing, Matt. It is generally the population over 65, and when you get over 80, the mortality rates skyrocket. But as soon as you get over 60, 65, and that should be very concerning here in the West because we have older populations. And also we need to remember is all of the mortality is not in the older age group. There is young, healthy people that die rapidly of this disease, and we don't understand why. I spent a lot of time in China talking to docs, trying to understand what do you think's going on, and they didn't even have a gut feeling, and that's concerning.
That must be very scary.
Yeah, it is. Now, remember, we don't want to scare populations. This is a disease that can be managed, that you can respond to. The population is the most important part. It's the surveillance system. It's what gives you the speed. And if you take the right precautions, follow the advice, Public Health England, they're experts at this stuff. You're really going to reduce your risks and help them find it fast. Because, an orderly response to this thing, and that's what they kept saying in China, is you can manage it.
Dr. Bruce Aylward, thank you very much for your time.